Hi, I'm Dr. Carpentier. I'd like to talk to you a little bit today about fibromyalgia and the central sensitization syndromes. I've talked before about the difficulty of making the diagnosis of fibromyalgia syndrome, how it can often present as other conditions. There's so much overlap between the fibromyalgia syndrome and many of the other central sensitization syndromes that we can often be confused about which condition we're dealing with, and the symptoms of one may look very much like the symptoms of another. For example, you may show up today with jaw and face pain and it will be confused with temporomandibular joint syndrome. You may have developed significant abdominal pain and cramping that appears to be irritable bowel syndrome. You may have pain in your bladder and pain with urination, which looks like interstitial cystitis. And how can it be that all of these different conditions can mimic each other? What happens with central sensitization is that the brain and spinal cord learn better how to experience pain. In other words, the volume has been turned up on your sensory system. Things that would ordinarily not be considered painful, such as talking or moving your jaw, eating a meal, can now become painful experiences. The brain has learned how to experience pain so efficiently that virtually any sensation that you experience becomes interpreted as a painful one. This helps explain why it can hurt to be touched or it can hurt to move your joints. Simple things that people don't think of as ordinarily painful are now painful to you because of the central sensitization. This goes a long way to explaining why it's difficult to understand the condition if you don't experience the condition. Looking in from the outside, somebody might say, how can it hurt just to move your arm? How can it hurt to roll over in bed? What can walking around the block possibly do to cause pain? If your body is so tuned to experiencing pain and every sensation you experience becomes a painful one, it's much easier to understand how normal activities of daily living could become such painful chores. How the central sensitization is set off is unclear. It could be a car crash, it could be an illness, it could be a highly stressful event. That's why it's so important that you keep good documentation of when the symptoms began and how they've evolved over time so that we can better understand if we are actually dealing with a central sensitization syndrome or something else that requires a very different treatment. So with central sensitization, everything hurts more. In the olden days, you could stub your toe and walk it off, but now it puts you in bed for 3 days. It's as if normally you would have a garden hose sending pain signals to the brain, but now you have a fire hose turned on full blast. Everything just happens more. It's more intense, it's more painful, it's more everything. It's important to understand that fibromyalgia is one of the central sensitization syndromes. You have to know about it before you can fix it. There are a variety of things that can be done to address it. Just as the brain has learned to experience pain, it can unlearn it. Techniques such as yoga, cognitive behavioral therapy, and mindfulness training can go a long way to making you feel better and not experience this heightened sensitivity and pain. Again, I'm Dr. Carpentier. I hope you're feeling better soon.